Good day everyone. Today we'll be talking about the psychoactive drugs, the depressants. Your consciousness is your awareness of yourself and your environment. Some chemicals known as psychoactive drugs can alter your consciousness by affecting your perception and moods. There are three main categories of psychoactive drugs. I want to tell you in the next part of my video. Depressant, stimulants and the hallucinogens. So let's start with the depressants. Depressants are drugs that lower your body's basic functions, neural activity and, for example, your heart rate, reaction time, processing speed and that kind of a thing. The most popular depressant you might not even think of is consciousness altering drug, which is alcohol. Alcohol, like other depressants, slows your neural processing. It slows your sympathetic nervous system down, which is a system which usually helps you to respond to dangerous situations. It means that you think and act more slowly. It can disrupt your regular sleep cycle, disrupting REM sleep. If you don't get enough REM sleep, your ability to form memories and new synapses is reduced. Because of that, alcohol can have negative impact on your memory and learning processes. Finally, what you probably know about alcohol is that its disinhibitor means it removes the inhibition. People who have been drinking more likely to act on their impulses, which lead to impaired judgment and reduced self-awareness and self-control, which covers what we have to talk about alcohol. Other type of depressant is barbiturate, which is also called as tranquilizer, which is not used much. So it usually used to induce sleep or reduce anxiety, and they work by depressing your central nervous system activity. Some side effect of barbiturate includes reduced memory, judgment, concentration, and when combined with alcohol can lead to death. On a side note, combining alcohol with drug is generally a bad idea, for the body can only handle foreign substances one at a time. Most commonly prescribed suppressant drugs are benzodiazepine, which sometimes are called benzos for short. Benzos are most other depressant, which enhances your brain's response to GABA, which is inhibitor neurotransmitter, which basically works up as benzos open up GABA activated chloride channels in your neurons, which allows more chloride ion to enter the neuron and make more negatively charged, which then makes it resistant to excitation. And that's why these drugs are most often prescribed for sleep aids or anti-anxiety medications. So there are three types of benzos: short acting, intermediate acting and long acting. Short and intermediate acting benzos are usually prescribed for insomnia, whereas long acting benzos are preferred for anxiety.
Normally I'd be a little more energetic, zipping between the brain's dendrites and axons, doing my job as a neurotransmitter. But today, well, we neurotransmitters are being affected by depressant abuse. Depressants are controlled substances that slow down the brain's functions. Right, GABA? That's right. Hey, I'm gamma aminobutyric acid, but my friends call me GABA. I'm a neurotransmitter like Ace. My job is to help calm things down in the brain, but not this calm. When depressants are prescribed by a doctor and used as directed, they help people with serious anxiety and stress that interferes with their lives, work, and families. Not usually for when you're worried about everyday things like a test, game, or relationship. While depressants can help people with a diagnosed medical need, abusing them by not taking them as directed by a doctor could harm your brain. Depressant abuse can keep you from getting excited about the things you love. Eventually, you might need to take them just to feel normal. And abusing depressants can slow your body function so much you could end up in a coma. Or even dead. If depressant abuse isn't bad enough, combining them with alcohol or other drugs is even more dangerous. It's time we break out of this stupor. Depressants are only useful when you use them correctly, and that means under a doctor's supervision. Goodbye now. See you next lesson.
The pharmacokinetics of 6 different benzodiazepines in list will cover lorazepam, alprazolam, diazepam, clonazepam, temazepam, as well as triazolam. We'll take a look at the time to peak concentration, bioavailability, elimination half-life, and excretion in lorazepam. The time to peak concentration is 2 hours, the bioavailability is 90%, the elimination half-life is 12 to 14 hours, the excretion is fecal 7% and renal 88%. In alprazolam, the time to peak concentration is 1 to 2 hours, the bioavailability is 90%, the elimination half-life is 11.2 hours, the excretion is fecal 7% and renal 80%. In diazepam, the time to peak concentration is 1 to 1.5 hours, the bioavailability is more than 90%, the elimination half-life is up to 49.2 hours, the excretion is renal, and clonazepam, the time to peak concentration is 1 to 4 hours, the bioavailability is 90%, the elimination half-life is 30 to 40 hours, the excretion is renal, less than 2% unchanged, and the temazepam, the time to peak concentration is 1.5 hours, the bioavailability is 90 to 100%, the elimination half-life is 8.8 hours, the excretion is renal, 80 to 90%, and the next and last final drug is triazolam, the time to peak concentration is 2 hours, the bioavailability is 44%, the elimination half-life is 1.5 to 5.5 hours, the excretion is fecal 9% and renal 80%. Benzodiazepines have multiple effects and some adverse and some beneficial effects. They interrupt the normal sleep cycle by causing an increase in stage 2 non-REM sleep and a decrease in stage 4. Pregnancy is a contraindication for the benzodiazepine use, and these drugs are pregnancy category D and X. Taking benzodiazepines while pregnant may result in floppy infant syndrome, where the infant is born with hypotonia, hypothermia, lethargy, breathing and feeding difficulties. There is also a slight increase in the risk for the cleft palate in the newborn. Benzodiazepines don't cause the same enzyme induction with the barbiturates. Therefore, there is a less metabolic tolerance induced by these drugs. Also, unlike barbiturates, benzodiazepines have a seeding effect, which limits their ability to cause CNS depression. This is definitely not to say they aren't potentially dangerous. If used improperly, they shouldn't be mixed with other CNS depressants such as alcohol, and they shouldn't be used while driving or operating machinery. Some patients may become dependent on these drugs.
Benzodiazepines belongs to the prescription sedative class of drug. Although benzodiazepines have a calming effect, they are highly addictive. The sedative effect of these drugs as well as their addiction-forming chemical properties make them ripe for abuse. Since these are prescription drugs, it is critical to note that some individuals may initially have a legitimate medical reason to use them, but over time they develop a use disorder. If a patient who has prescription for benzodiazepines follows their doctor's order, a use disorder will not likely set in. But if a use disorder does arise, there are different ways people go about getting the volume they need. Legitimate doctor will not overprescribe these medications. Most people who are prescribed benzodiazepines for anxiety prefer these medications for the treatment of their condition because they can take them on as needed basis. Most patients can use benzos judicially, but when someone uses these drugs for a long period of time or uses in excess, this can lead to development of benzodiazepine dependence and tolerance. Every person's body chemistry is different, and the time it takes for someone to develop a tolerance for benzos will vary from person to person. The amount of benzos someone uses and other factors can also influence how quickly they develop a tolerance to these drugs. The behavioral signs of benzodiazepine abuse includes the person withdraws from friends, families, and obligation in order to use the drugs. There is shifts in mood or personality are experienced. They uncharacteristically secretive about daily schedule and tells lies to protect the substance abuse. They spend an increasing amount of time and energy on different facets of drug abuse. They engage in risky activities such as driving after using the drug. The person does uncharacteristic things to able to pay for drugs such as borrowing money, stealing, draining bank accounts or maxing out credit cards. From a place of fear of being without the drug, the person ensures that an adequate supply is maintained at home. The person exhibits a reduction in effort to maintain hygiene or grooming, that is, the person may begin to look disbehave. In short, the person stops being in service of the life they used to lead and now spends an increasing amount of time in the service to the drug abuse. Benzodiazepines overdose and abuse may cause the following symptoms, such as physical weakness, slurring of speech, confusion, poor decision-making abilities and poor judgment, blurred vision, lack of motor coordination, dizziness, inability to defend oneself in the case of an attack or threat, drowsiness, coma, difficulty breathing, death. It's rare when abused on its own. Fatal overdose may occur when a benzodiazepine is mixed with alcohol. If a person is chronically abusing benzodiazepines, the following symptoms may emerge: anorexia, insomnia, anxiety, tremors, headache, and memory problem. For the treatment, if drugs were taken within the previous 1 to 2 hours, the doctor may consider gastric lavage. A single dose of activated charcoal is recommended for people who came to the emergency department within 4 hours of taking drug. There is an antidote named flumazenil. This reverses the sedative effect of benzodiazepine. However, usually reserved for severe poisoning because it can cause withdrawal and seizures in people who are chronic benzodiazepine abusers.